late husband, Marty Stites, was a remodeling contractor by day and a rock musician by night. He believed that there was a cure for his prostate cancer, even though it had gone into his bone and was very painful for him. He still had a lot of faith in the physicians and the healthcare. We have a daughter, Claire, who's 16 now. You know, she feels sad that he's not going to be there for her graduation, her marriage, that kind of stuff.
Her name was Susan. She was a teacher, elementary school teacher by profession, professional mom, loved kids. She was a kid magnet. She taught for 5 or 6 years before we had our first child. We ended up having 3. But after the first, we agreed that she would leave the world of gainful employment, become a full-time mom, which she did for 13 years before returning to teaching in the public school arena. She had been back to work for about, I think it was 4 years, and then was diagnosed with brain cancer. She was experiencing seizures. In 2006, at our church, came along the opportunity to do a short-term mission trip to Russia. And so with her doctor's qualified blessing, we went on that trip. In 2008, along came another opportunity, this time to go to Sudan. Again, because kids were involved, she was determined to go. And so I tagged along with her. She loved that experience. She loved those kids. Made sure they had uniforms when she got back to Hillsborough, raised money to send uniforms there. She was determined to live.
I really felt like somebody had my back, because at that point you don't know what people are, what you're going to do. You just have no clue, because you've not, if you've never been through it before, you don't really know what to expect. It was like the whole focus now shifted away from this, treatment to kind of, work on the cancer, to now it was about you, Marty. It's about you, and it's about your family. And it was tremendous, because what it afforded us is the last 3 weeks that he was living, our house was full of people, friends and family.
Changes were happening every couple of days in Susan's condition. Having the hospice nurse there, healthcare professional, who understood the death process as well as the specific kinds of symptoms and conditions that Susan was experiencing, I can't tell you how comforting and what a tremendous resource that was. The hospice nurse who was assigned to us was named Susan as well. Gentleness, compassion, professional, knowledgeable, angelic.
Our mutual friend, Karen, she had mentioned talking to Jim. She says, you ought to talk to Jim, because he's been through this and he had very similar experiences. And so, being the person I am, I just walked right up to him. Hey, do you mind talking about this? Of all the people probably that came over to visit, I probably spent the most time in depth talking with Jim, because of what he had already been through.
I knew Marty not, extremely well, but what I knew I really liked. So after he passed away, we had this connection. And before long, where did you come from? is how it worked.
Yeah.
It just sort of suddenly seemed like I wanted to see her a lot more. So now I'd get to. Marriage for both of us had been profoundly good experiences, and we could see that potential again. It's occurred to me that hospice and palliative care is very much about living. Living until you die. Not quitting before then.
I think there's a hurdle in people's minds, particularly, if they're thinking about what limited knowledge they have about hospice in general. Hospice tends to be the death and dying process, where palliative care, people don't understand that, as Jim mentioned, is really about helping you live the best you can right now.